Welcome to the Fascia-Informed Therapist, the essential podcast for occupational therapy professionals looking to deepen their understanding of fascia's pivotal role in therapy and health. I'm your host, Amy Mayer, an experienced occupational therapist, practice owner, and dedicated educator. Here we'll dive into the fascinating world of fascia, exploring its significance in the human body and its critical influence on occupational therapy practice. Each episode will bring you cutting-edge insights, expert interviews, and practical strategies to help you confidently integrate the science of fascia into your therapeutic approach. Whether you're a seasoned practitioner or just starting out, our goal is to equip you with high-quality, evidence-based, and fascia-informed continuing education opportunities that will enhance your skills and benefit your clients. So join us as we unravel the complexities of fascia and transform the way you practice occupational therapy. All health and wellness practitioners are welcome. Let's learn, grow, and evolve together. Hi, this is Amy, and this is another edition of the Fascia-Informed Therapist, and I'm excited today to have Kaitlyn and Maddie with me. We're going to be interviewing Maddie about her student experience. So Maddie, would you first introduce yourself and tell us about first your journey into finding occupational therapy?
Yeah. So my name is Madeline Seide. I am originally from Minnesota, and I took kind of the non-traditional path to occupational therapy. Initially, after high school, I ended up joining the military, and I served for over 5 years as a combat medic, so that path was a little bit non-traditional in and of itself. But I didn't go to college while I was in the service. I waited until I was completely out of service to start going to school. And in that period of transition from the military into civilian life, there was a lot of self-discovery that I was going through. I all of a sudden had kind of ideas, but I didn't know where to start. And they kind of place people around you to kind of guide you into one path or another, but every time I had someone kind of guiding my hand to one direction or another, it didn't feel authentic to me and what I wanted.
Where did people want to guide you?
Well, initially it was, you can start in the biology program and maybe you'll go and, work in wildlife biology or something like that. And I didn't really like that. And then I, had switched into psychology, which I loved, but I didn't know what I wanted to do with a career with that either necessarily. Nothing really rung my bell. And I was like, wow, I wish there was something that was a little bit healthcare and a little bit psych and a little bit something hands-on that I could do. And please let it not be physical therapy. Not because physical therapy is bad, but I knew that it wasn't my path. So I went down this rabbit hole reviewing, professions that I had experienced in the past and what I was still curious about and what I really liked about them. And I just kept coming back to occupational therapy because it stood out from all these other professions. It was a little bit of every little piece that I seemed to enjoy, and then it offered me the autonomy of having my own professional license and offered me the autonomy to create something entrepreneurial in the future if I wanted to too.
Now we know how you found OT. How did you find about fascia and the intersection of fascia and OT?
So I had been a little bit fascia familiar since I was initially working in the outpatient clinic when I was in the military. You know it from the injuries that you encounter. So I was seeing a lot of people who had plantar fasciitis, their feet always hurt. I was seeing people who had things like exertional compartment syndrome where they were very active and all of a sudden their fascia was tight and not moving and their muscle wasn't able to really swell the way it needed to. So I'd heard about it, but we didn't focus on that. It was all about muscles. It was all about the muscles that you use, what they do for you, and the muscular dysfunction. If they couldn't explain why someone felt some kind of way about their body, it was DOMS. It was always, this has got to be delayed onset muscle soreness. And I kind of always felt that was reductive, and I felt it more and more as I started having some kind of physical dysfunction also. So I started having these pains that wouldn't go away, and these things that, general muscle care was not taking care of. So the longer I sat with it, the more dysfunction I experienced. And it wasn't until I had kind of more fascia-forward treatments that I really was like, this is mind-blowing. And at that point, I hadn't even experienced myofascial release. And if I knew what I knew then, or know now, know then, knew then what I know now, I think that would have made the biggest difference in my quality of life at that time. Because physical pain and mental health are so connected as well. I think a lot of the people that I had served with could have also really benefited from it, and it would have made a world of difference in how they were able to care for themselves, or how the providers that I worked with cared for the people that they saw. So it wasn't until I was in my first year of OT school where I had Kaitlyn was in her Capstone period and offered a free self-treatment course. And I thought, I'm a graduate student. I love free. Free's my favorite. But that blew my mind. And the more I learned about fascia from you both, I was just in awe. I was like, how does everyone not know about this? How have I let this gap be here for myself? I almost blamed myself for not knowing about it. I felt like it was something that I missed. I should have known about this. I should have been aware about this. Why weren't the people that, taught me everything I knew up to that point talking about this? And finally I just took a breath and I'm like, this is how information works. We're not all one collective consciousness. So, it has since become a passion of mine also to talk about this, because it's made such a difference in my life and my quality of being that, I want to scream it from the rooftops and tell everyone else about how this can benefit them.
Yeah, cool. So I'm curious, what did you envision for yourself after going to Creighton and getting your doctorate in OT compared to what was the vision before you learned about fascia? Or was there one? Or you just knew OT was a good fit for you?
I knew OT was a good fit because I liked how it approached patient care. And I also knew that it was one of the most dynamic healthcare fields.
Yeah.
So I kind of went in thinking I would be working with traumatic brain injury or spinal cord injury. And the longer I was there in school, more and more aspects of occupational therapy and the role they play were brought up. And then we would go on these field works. We'd go on these 1 week field works to begin with, and then we would do our level 2s, which were longer. But I got to experience all these different areas of OT. And so the more I learned about it, the more confused I got, because I capture people's passion. It's contagious, right? If someone's really excited about something and wants to tell you about it, I capture that. So I felt that way a little bit about PEDS, and I felt that way quite a bit about burns, and I felt that way about neuro. And the more I saw these different sides of OT, I was like, well, crap. Now I'm now I'm even more confused. I love it all. Where do I start? But what I kept coming back to was my own self-treatment. So I had these tools that Kaitlyn had provided me at this workshop, and I found myself going back to them and using them. And I found myself using them to take care of myself when I was, in the depths of studying, when I was sitting like a cooked shrimp for hours on end, knee-deep in a PowerPoint or in a paper. And it made me more curious. I was like, well, I'm interested in all these things, but this is what I keep coming back to. This is what I use for myself. What if I explore deeper into the wellness side of OT? which we didn't really talk about much in school. We talked more about traditional forms of OT practice. But seeing that there was a wellness side, that really piqued my interest. And it got my mind racing with, well, where does OT fit into this wellness sphere? And how can it really embolden someone's quality of life through our practice?
And just to clarify, the free workshop that Maddie attended, Kaitlyn taught as part of your rotation.
Yep.
That Maddie just finished. And that was 2 years ago?
Yep.
2 years ago. Okay.
You got to say it like a baby's age. Like, oh, it was about 24 months.
Chronologically.
Chronologically, yeah.
My brain still works in semesters, actually, from teaching for 20 years. Okay. All right. So, question. I think you came and took the 7-hour CE that we do in our office before you went on your 2A and B, right?
Yeah. I'd actually taken a 20-hour myofascial release course, and then I had taken, I don't know if it was a 7-hour CE. It was the head, neck, and shoulders CE.
Oh, that's right.
That I took.
That's right.
And that one blew my mind. That one, I was like, this is where they're hiding all those good ideas. And there was so much information at the end. Like, I felt like I had learned so much, and I was also so hungry for more. And I was like, we just touched this one small part of the body. Like, I need to know more about this, because that one really gave me tools for application that I didn't get out of the 20-hour course that I had taken prior. It gave me real tools to apply, and my partner is very thankful, by the way. He has benefited the most out of that course, for sure.
Okay, the reason I asked the question is you took them before your 2A and B. Did it make you think about how you could apply that skill in those fieldworks?
Oh yeah, I was hungry to find where I could fit it in, because again, for the longest time I'd kind of kicked myself for, like, it was like fascia was the gap that I was like, why didn't I know about this? Like, where were you on that one, Maddie? Like, and so I was hungry to tell everyone else what I had learned. And my first level 2 was in the trauma ICU. So granted, there are higher priorities generally. And I remember I sent y'all an email about, well, is being chemically unconscious a contraindication for these practices? Which sounds ridiculous, but it shows, like, I was like, if I wanted to really lay out how this could fit into this practice in this role here, I got to think more dynamically about what would be indications, contraindications for the area of practice that I was working in. So luckily, I shouldn't say luckily, I didn't do a lot of it in my 2A, but granted, there were things that are prioritized over that at that point. But I did get to educate in an in-service presentation to all of the therapists that worked in acute settings. And so I developed this, ended up being like a 45-minute long presentation about how myofascial release can be used in the acute setting and how they could take these skills and apply them right away, so that when they did encounter a patient who they felt would benefit from it, they would know, hey, this is another tool in my toolbox if I want to reduce the rates of refusal, or if I want to help with mobility, or if they are having types of some limitations that this could help decrease, working with any of those. And then I did do my level 2B in a skilled setting where I got to apply them more often. And again, the people that I had worked with, they weren't as familiar with it. I think they had heard about it, but they didn't have any sort of hands-on experience with it. So and luckily they were open-minded too. So when I would suggest, like, hey, I think we should try this, they were like, oh, well, yeah, you're a student, give it a shot. Yeah. And that was cool, getting to apply it and use it for something like seating and positioning. So someone wasn't, sitting completely sideways in their chair. But then having the conversation about, well, how do we hold these, this space that we have then created? Now we need to address how the wheelchair is, contributing to this. Now we got to address, how he's being positioned in his chair over time. And then it goes a little more down into the traditional OT side of things. But I got to integrate it a little bit in each area of practice before coming here.
Great. I think one of the benefits of taking students is them bringing their knowledge and inserting it into the existing knowledge of that particular workplace. Do you think you changed any minds about fascia or made them more fascia curious in either one of those settings?
I hope so, especially in the acute setting, because I don't think a lot of the people that I had given my presentation to even thought that was something that was in their wheelhouse.
Really?
Or even like an option as a form of treatment. I hope I made people curious about it. I hope I made them kind of wonder, if that's something that they want to, put into their toolbox in the future or get more information on. I think when people are really honing in and refining their practice, sometimes they hang on really tight to just traditional ways of working. And sometimes it takes an out-of-the-box thinker to come in and say, well, this fits too, Like, your toolbox isn't always full. And I think that's where having, like, fascia-informed content as continuing education really benefits the OT. Because otherwise it just seems like magic. It does. So when you're able to put science to practice to application in that order, it makes something that looks so simple really reveal that it is affecting something very complex.
Okay. If you have questions, you're welcome to ask them. We're already way off the question list.
I figured that's how it'd go.
So my next thought is then, what made you decide to come and work with us and do your capstone with us? Or at least come and ask and take an interview with us and talk about it.
Throughout the different types of OT that I had experienced, this was the only one that rung my bell. It confused me. I was confused by it in a way. Because I didn't understand this, I guess it was like passion that was like welling up, and I was like, what is this feeling? Like I feel drawn to this. I feel excited about it. Whenever I talk to people about what I've learned, I find myself just like rattling off information and thoughts about these practices and wanting to know more and diving deeper into the research. And then all of a sudden all my school projects became about it. And then I was like, well, let's read the writing on the wall here, Maddie. Like, this is what you like and this is what you want to do. So why not, like, if you get this opportunity to create a semester-long course just for you, it can be about anything that you want. Well, what do you like? And what really like lights you up? And it was fascia. And it was learning more about it. And it was learning more about these techniques that affected people's pain and their quality of life. And that just excited me so much more than the other types of practice that I considered doing. So I knew that if this is something I wanted to learn, there was one place I needed to go. If if I wanted to learn from the best. And that brought me to y'all. And I'd already had a very positive experience with Kaitlyn's workshop. I had a great experience taking your head, neck, and shoulders workshop. I kind of knew enough about the both of you to know that that we were going to vibe well. I kind of already knew that we would have some kind of chemistry, and I wouldn't be left out to dry with a question and left out to dry with answers. So I knew that I would be supported through the process too.
I'll confess that when you came to the head and neck workshop, I thought you were the most serious student I've ever met. And now I would describe you as someone who smiles and laughs quickly and has somewhat of an irreverent sense of humor.
I'm flattered because I also describe myself as somewhat irreverent.
I think that we realized once we got to know a little bit more about you that you were just nervous and excited to be there. And you just wanted to do well and learn as much as you could. And you were taking the opportunity seriously, that not necessarily that your personality was as serious as we had initially thought at first, which...
yes.
Yeah.
And I kind of very much live by, you can take what you do seriously, but you don't have to take yourself too seriously.
Oh, amen.
Yeah.
And I think more people should live by that. To each their own, but it's good to be able to laugh at yourself and also really focus in on what you do and want to refine that and be serious about that.
Absolutely. Tell everybody a little bit about what if you're not familiar with the Crate and Capstone, you create your own learning objectives and then your learning activities. And I don't remember what all the correct words are anymore, but tell everybody a little bit about what your learning objectives were for the time you spent with us.
Yeah. So I had kind of broken down my capstone into multiple parts. I wanted it to be PC because I was interested in so many things, and I knew they all fit together in like the big picture of things. But I needed to break them down into these small bits, and I think reading them at first would have made someone go, well, how are these all related? So the first part was looking at myofascial release, looking at fascia-informed practice, researching best practices, learning about them hands-on, and excuse me, going deeper into the understanding of that. So including getting another CE and being able to participate with you both at instructional activities that you do, whether that be teaching a CE to a group of professionals or attending the self-treatment workshops, getting to dabble in what that looked like for best practices, day in and day out. I don't know if there was ever a day where I wasn't either hands-on or actively observing instruction of techniques. But that also led me into my second part, which was what also drew me to this practice was the entrepreneurial side of things. I'd been asked a lot by my family or my friends, why aren't you going to PA school or something like that? And I had really liked the thought of having my own credential. Not that PAs don't have their own credential, but I liked the autonomy that occupational therapy has. And I liked that we were able to open up our own private practices. And I liked that we could kind of create what we wanted out of that too. And because our field was so dynamic, it was like, well, if our field is this dynamic, working in traditional practice, how dynamic can it potentially be in, private practices in these outpatient settings? And the longer I went through school, the more I was like, wow, we really can do so much. So I wanted to dive deeper into the entrepreneurial side of things. I wanted to talk to business women, business people that were out here doing their own things, that, felt a passion about something and then committed to it, which I think is, that's always kind of been like a little bit of an intimidating thing to me, not to just like commit to something and do it, but to transition to being your own boss. There's a risk and reward in that. And I really admire people who've taken on that risk and have thrown themselves into creating something of their own. So getting to observe entrepreneurship, and that involved not just learning from you both, but interviewing other healthcare entrepreneurs too, from acupuncturists and dentists to chiropractors, to mental health therapists. There were so many people that I wanted information from, because I didn't just want information on OT. I knew that I would be covered in OT. If I had questions about OT, I knew where I could go. But I wanted questions about healthcare business and I guess all the little details around that, from, what are they doing now to where they started to were they scared when they decided to make that jump, or was it really more natural for them? And maybe some of those questions were a little to soothe my own anxieties and curiosities. But then I also had an aspect of Capstone that involved looking deeper into trauma-informed practice, because I know that pain and mental health are so connected. Mm-hmm. But I also know that pain and trauma are connected. Mm-hmm. There is so much research out there about instances of chronic pain and its correlations with trauma. And if what we can do affects pain, then how do we impact someone's quality of life with someone with trauma? So I wanted to learn everything about it. So I threw myself into creating a learning module, like a level 1 kind of learning module for trauma-informed practice for the healthcare provider, which went into a little bit of the neurobiology of trauma, but then also went into the basis of trauma-informed practice. I made that generally for the healthcare provider because each healthcare field is so dynamic in their own ways. And I would love to create something that's a little more directed at OT specifically, and then branch that off to where we talk about each area of OT, whether that be for OT in the acute setting in trauma-informed practice, or, OT in the outpatient setting in trauma-informed practice, whether you're in a skilled facility or if you're working with a certain type of population, like a military population, or working with people with certain factors like historical trauma or other structural trauma contexts. I was really wanting to build these connections because I knew that the fascial system is our system of interoception also. I knew it all tied back. So I wanted more information about interoception and its role in overall health, and then its role in trauma too. So I spent time researching and gathering information, and it's only made me more excited to just tell people what I've learned so far. And no matter what the future has in store for me, I know that everywhere I go, I'm going to be talking about fascia and its roles for whether it's managing pain or helping people feel things more accurately in their body, or whether I stay in the wellness sphere, whether you go into different areas of practice, connecting it all back. And then finally, I finished up my capstone by creating a self-treatment workshop for a population with suspected trauma. I ended up choosing military-connected peoples, so whether they be active duty, reserve, veterans, or their family members, creating a self-treatment workshop designed specifically for them and teaching them how to apply these techniques and sending them along with the tools and the knowledge to continue self-treatment at home too.
Okay. Okay, so we also asked you to take our fascia science course, right, for OT practitioners. So is that something you think is appropriate for students to take or other therapists to take? can you say a little bit about that?
I wish everyone would take it. I'm also of the mindset that people treat occupational therapy students very tenderly when it comes to offering them information. And OT students have already shown that they are incredibly intelligent, incredibly capable. These people have been weeded out to get into their programs. They're already highly competitive, highly educated, and we shouldn't refrain from giving them content that may be above their level of understanding, because they're capable of learning and they're capable of reaching out to somebody if they don't understand something, and they're capable of researching it. They're getting the tools in academia to learn how to, research a topic more thoroughly. Also, a lot of the doctorate programs, there's a whole course about it, and critical appraisal of research too. So I wish that course had been part of my curriculum, because I felt like it would have elevated my entry-level practice. I feel like it would have elevated anyone's entry-level practice. To put advanced concepts in the hands of a beginner, yeah, it sounds maladaptive, I guess, but we're not, students in junior high. We are college-level, doctorate-level academics, and you should put this information in our hands and let us run with it.
Okay. I typically think of students who are getting either their master's or their doctorate as very busy and not having a lot of extra time for things like that necessarily. But anyway, I also want to be very clear that Maddie has passed her capstone with us, and
Yes.
we didn't tell her she had to say these things in order to.
I am not under duress.
All the paperwork is in, and
She will walk across the stage on Thursday.
yes. So I would like to hear your definition of a fascia-informed therapist, or your explanation.
Oof.
Good question.
Thank God I've already passed and you've already turned in my grade. I think a fascia-informed therapist is any kind of therapist who keeps fascia in mind in their practice and sees how fascia could be impacting the well-being, quality of life of the person they're serving. I know that you've done a lot of crossover work with Lisa Baselli, who's an integrative psychotherapist. That's a therapist that can be fascia-informed. Occupational therapists can be fascia-informed. Physical therapists can be fascia-informed. Respiratory therapists can be fascia-informed.
Yeah.
It's not just limited to one type of therapeutic profession. But a fascia-informed therapist is someone who is aware of this system and is curious at how we can affect that system for the betterment of their patients, or offer opportunities for collaboration with another profession who may be more versed in those techniques too. Not that a mental health therapist needs to be hands-on with fascia work, but they can know enough about the fascial system to reach out to someone who may work hands-on with the fascial system and be able to offer a professional collaboration that benefits the patients or clients.
How'd you do, Kaitlyn?
I think pretty good. I thought of a question. Even though you haven't taken boards or anything yet, but you have your doctorate. I mean, you're getting the piece of paper on Thursday. Would you consider yourself a fascia-informed therapist moving forward?
Yeah. Isn't that so exciting? Like,
Hell yeah.
yeah. Yeah.
I hope so.
Yeah. I mean, I was about to be like, yeah, I hope so. I hope you would consider me one also. But I know that a lot of my classmates have already expressed to me, where do I get started with this? How do I become, educated in these? These techniques are, yes, the techniques are advanced and the information is plentiful. And I have now done 14 weeks plus extra learning with y'all about becoming fascia-informed. So a little Uno reverse card here. How do you I'm in charge now.
Bring it, Shirley.
Where do you suggest students, entry-level practitioners that want to become fascia-informed but may not have done their capstone experience and things like this, or had access to professionals that would have taken them on to teach them these things? Where do you suggest students and entry-level practitioners or advanced practitioners, where do they start? What are the first baby steps they take towards becoming fascia-informed?
Thank you. Fascia-Informed.com. I mean, that is where, I don't know how my path exactly got here, but I feel like my whole 34 years now of professional life has triangulated or evolved into helping especially OT practitioners understand fascia and its importance, not in just practices like ours, but all practices, because I have known about fascia for 34 years now and have practiced in almost every setting that exists in the world of OT, from mental health to peds to everything in between. So I would love it if people would come to my website and see what I have to offer. But the first thing I would say is that you have to understand the science before you learn the skills. Otherwise, you're just you're a tech, basically. You have to know the science before you know the skills. So learn the science. Mm-hmm. Okay, that's enough of a commercial break. Back to you, Maddie.
This commercial is sponsored by the Fascia-Informed Therapist.
Exactly. Okay, so at what point in your rotation, your capstone rotation, did you go, oh, this is what fascia-informed therapy is? Was there a moment when it kind of hit you? Was it during an eval? Was it during some instruction one of us was giving to a client? Was it something a client said?
I think it kind of happened like people describe falling in love, like little bits at a time and then all at once. And the little bits happened every single week when we saw new clients or had seen clients that had come back and you had seen their progress. When we'd had clients that, had been seeking one type of modality and they came in and they're like, well, I really want to work on this instead. And we were able to kind of work with them on something else. It wasn't just one moment. It was so many moments of getting to witness how people responded to the techniques, whether it be acutely or after, seeing them for weeks on end. It was seeing that it was more than just being hands-on. It really was this therapeutic approach that you and Kaitlyn have really developed, and building that relationship, and where my space in that relationship was also as the student. And as I started to build those therapeutic relationships with people that we got to see more often and more often, when Kaitlyn lovingly refers to it as the time she kicked me out of the nest, when I started seeing my own clients, it was like this wake up, like this was the all at once moment where I was like, oh my gosh, like I have been like dabbling in this for weeks on end, and now I am working with this. I'm practicing being fascia-informed actively. And a little bit of an intimidating thought at first, and then it just became so natural. And you realize, like, yes, we integrate the science, and yes, we seek to problem solve certain things that our clients bring to us, and at the same time, it all comes back to that therapeutic relationship and that trust that you build with the clients as they come in, and how that is the root of that practice also is being client-centered while being fascia-informed at the same time.
I think just for context, so Maddie spent the majority of her time with us with me, and then also spent some time with Amy too. But I think there's an important thing to note that Amy and I did not mold Maddie over 14 weeks to think like us. What's been really fun is to provide the information and provide the context in our lens, and then she can create her own style in her way and take the information and apply it to the people she sees, whether it's in a similar practice setting or when she hypothetically were to be, you know, at a hospital somewhere or at a different practice setting. Just like I have a different style or how I perceive the information and utilize it in traditional and, you know, my non-traditional practice settings, creating the opportunities for Maddie to put those pieces together of, oh, this is how this part of this information and this information on top of what I learned in OT school creates this new way of thinking about the human body and this new way of educating. And I think that was fun to kind of see unfold over 14 weeks. It wasn't like we just gave Maddie this information and wanted her to regurgitate it perfectly. It's about seeing how she developed it as a therapist that's going to continue to evolve over her career. And that was fun over 14 weeks. Plus.
Yeah. Any particular client stories or anything that stands out to you as, can you share one with be HIPAA compliant?
Yeah. Kaitlyn and I had seen someone who they had this pain in their body for a long period of time. Cookie cutter kind of story for a lot of the people that come to see us, but she had tried a number of different things. Not one had really stuck or benefited her. And during the initial evaluation, we probably had 45 minutes of treatment time. And at the end, this client had a very intense somatic reaction. And it wasn't bad on her part, but even she was shocked by it. She was shocked by what she was experiencing in her body. She was shocked by, you know, the feedback that she had given or gotten from the education that we had provided. All of a sudden, she was able to take a efficient, deep breath, and how that altered how she was able to relax her body and really have the treatments be even more effective. She was, you know, feeling these like tingly sensations in her body, and she was a little bit shaken by that. Not like in a negative way shaken, but just shocked that something had her body responding so different than how it had responded to other things in the past.
And for something so foundational.
Yeah, I think we're you know who I'm talking about. Yeah. And just like you were saying, something as so fundamental, foundational as taking an efficient breath. Well, if your body's been tightening up for a decade, all of a sudden you get some feedback and some coaching on how to take a deep breath for the first time in 10 years. Like, it's going to blow your mind.
Yeah. Thank you. Awesome. How would you describe our clients receiving you?
They were so nice. Yeah. I don't think there was any... Every time before a session, Kaitlyn would ask, or you would ask the person, you know, is it okay if Maddie joins us? I don't think there was ever a time where someone said no.
No.
Even though I was always prepared, I was like, well, I got other things I can be doing. You know, if they say no, that's fine too. But a lot of clients are here because they've had experiences with the healthcare before. And, you know, they've been around the block long enough to know that healthcare practitioners don't just pop out of the ground and we're like, oh, I'm trained. They know it's a process. They know that you are a student before you are a practitioner, before you are, you know, a master at your craft. So there was never a point where I had experienced a client who wasn't open to having someone observe, you know, their session. And it wouldn't have been offensive to me if someone had felt that way. To each their own. I was more concerned about when I started seeing my own clients if they would want a student to be working with them. And it just warmed me up seeing how open people were to working with the student and giving me feedback on my sessions and allowing me the opportunity to, as an individual, build those therapeutic relationships, to problem solve on my own, and to really work on developing my own style with all the foundational knowledge that you both had provided for me.
What week did we set her loose?
Set her loose.
Like loose.
Like taking her own client, like set up her schedule. I think about it for a second.
9 or 10.
I think, yeah, I want to
9 or
say
10.
it was.
I want to say it was a little over a month.
Yeah, it didn't feel like long enough, really.
No.
Because, I mean, we had clients knocking down the door to get back in with her once they saw her the first time. And I want to address that for the listeners. When Kaitlyn was a student, I've taken a lot of Capstone students and I've loved all of them in case they're listening. But I never, whether it was them or me, probably more me, never felt completely comfortable letting them take their own clients. And then when Kaitlyn came on as a student, I felt very comfortable letting her take her own clients. And that's an expectation in level 2s, right? That you're starting to take your own clients by midterm, at least, or before. So I wanted Kaitlyn to have that experience, and it was kind of a weird thing because we don't take insurance, and how would this work? And so I called Creighton just to verify that my thinking was okay with this, and that Kaitlyn could take her own clients as long as I was on site. And so that's what we did with Maddie as well, and we felt confident that she could start doing this, and we were on site. And we also offer, when a student is taking clients, we offer a discounted rate just to get them in the door, let the client have their own experience, but still ask them to pay something so they value what they're getting. And they are getting something of tremendous value. When you're in a Capstone experience, you're getting at least with us, it's a very intensive experience. And as Maddie said earlier, you were hands-on pretty darn quick, right?
Yeah.
Okay, so that's what that looks like in a practice like this. Okay, so you saw first how we shaped it was during the first week, I think it was, we let existing clients see you, right?
Yeah.
And then the next week we opened it up once you were kind of comfortable with the flow. Then we said, okay, any new evals, any new clients want to come in, and you had a couple the first week. Mm-hmm. Yeah.
Yeah,
and then
exciting.
And then
It blew up.
kind of blew up. And then several were trying to can I get in and see Maddie before she leaves? Mm-hmm. So that was fabulous. Do you want to talk at all about that experience of taking your own people?
I think that was what really, it changed my feelings about myself. It changed my confidence. And I had felt this about every level 2 when I started seeing my own people more independently. There's a growing pain that occurs around that time. And previously I had felt some distress around those periods, but I didn't feel that this time. I felt a nervous excitedness because I also felt like I had been adequately prepared. I felt so excited to apply what I had been taught, and I felt so excited about problem solving with new people once I finally started to take new people too. And also, eager to make a good impression because I was representing this business that you had built, and I wanted to adequately and honestly reflect the values that you bring, and also just get a chance to just do the damn thing. Do we need to edit that out? Do we need to edit the D word out?
I think I already said no, so it's okay.
So that was really exciting. And it allowed me to let my mind race. And I would catch myself like laying in bed at night. My partner would be asking me about like what we're doing this weekend. I was like, shh, no, I'm thinking about something I could have done differently, or I might want to try next time, or that I want to bring up to Kaitlyn and Amy, like a question, or now that I've like reflected on this. So it was a lot of fun. And I so genuinely appreciate everyone who took a chance on a student to give me these opportunities to learn and grow and be a part of this process with me, because it's made me so much more thankful and overflowing with gratitude for the people that bring us to this level. Every client who I've gotten to see, whether it's with the two of you or on my own, this is someone who has given me an opportunity to learn. And it's equally as important, the role that our clients play in a student education as, the fieldwork educator.
Yeah. I think for context too, Maddie is my first student of hopefully many to come, which is a little nerve-wracking to have your first student be a Capstone student in some ways. And obviously Maddie was a fantastic student, but I think it's also important to think about as business owners too. These are external people coming in and trying to experience what you're offering. And I think there was a lot of me who was just trying to keep my baby in the nest, not necessarily in fear of like, I mean, clearly she was way beyond her, I guess, years as an OT. So that was definitely more of a me thing than obviously Maddie's skills at that point. But I think it's so fun to be in that room together and getting a second set of eyes to problem solve with. And just like when I was your student, sometimes after we would get done seeing somebody, we were bouncing stuff off the walls for probably the whole, time frame until our next person, right? And all that's very productive conversation, and just like I would hope it was your experience when I was a student, bringing those new ideas and whatnot. Maddie did that for me too, and I think there was a part of me that was like, I don't want to let go of that yet, in all the best ways, but just for the context of outside people. But
yeah, I thought we made a great team. When I became more proficient, we started working not just around each other, but like with one another. And we were able to apply forehands to our clients, which they seem to really appreciate.
Oh, well, yes. My clients love when we take students, because they're like, is Maddie going to be with Kaitlyn or you today? Yeah. And one client particularly scheduled his sessions because he knew you would be with me. Okay, something else I wanted to address that Maddie mentioned earlier was, I don't remember if you used the word brand or not, but values. Yes. I always talk to students about the brand that I'm trying to create in my practice, and making sure that they understand that they need to uphold that brand. And by brand, I mean, I don't want people just coming in and getting on the table and then they leave and without any new understanding of their body, so that they're integrating. I expect these guys to integrate the science that they know and be able to explain it in a way to their clients that makes sense to them, and that they're educating them about posture and movement and how important those things are in healing yourself, and all those other underlying things. Maddie referenced the breathing earlier. The lifestyle factors that feed into their experience of pain, and that's part of it. And if we're not doing those things, then that's not the brand. You're not following the brand. Get.
Go on, get.
I want that, and it's my practice I created. That's what I want. I want that blend of scientific knowledge, but also a relaxed atmosphere where people can feel super comfortable and very listened to, very heard in their experience of pain. They don't feel rushed. They can talk about whatever they want to talk about when they are here. So when you make sure that the people coming into your practice, whether they're other, employees, contractors, or students, you have the right to say that and expect that, not just to teach them the skills around it, but for them to uphold your brand. And I think that that is something that maybe some private practitioners are fearful that that's not going to happen. Well, you make that part of the rotation that that's going to happen, and then it all just works out.
Yeah. I think another thing to note about the brand is really, I think, something that we get compliments on a lot from our clients, and really probably from other professionals too, but is about our authenticity and transparentness, and that really gets dampered in a lot of traditional settings, and that's, I think, a part of a person's experience that is why people seek us out, is because we're creating that opportunity for people to feel heard and listened to, and at the same time, I'm bringing my doctorate level education and all of my training and my professionalism, yet I'm able to be real with people and have real conversations, and I don't necessarily have to dampen that down just because I'm helping somebody with their care and with our services. And I think that alone allows people to trust us and want to seek us out, because we understand how we can have very intimate conversations about how this impacts their life, at the same time being somebody who's right at their level that also is providing a level of expertise that they're wanting to learn from. And I think that's a huge aspect of where us as OTs have such a powerful role in that.
Yeah. And not that those sorts of connections can't be formed in other environments. They absolutely can. That we just are very, very intentional about that and create the kind of space, physical space and space of time, so that can happen.
Yeah.
Mm-hmm. Okay. Anything else you want to share with anybody who's listening about your experience or anything, Maddie?
If you're a student and you have curiosities in areas of OT that aren't traditional, do it anyway. If you find that a certain area really lights your fire, but it's not what other people around you expect you to do it anyway. Find a mentor. Find someone who's doing what you want to do, who really inspires you, who you want to be like, and do it anyway. If you're a practitioner who's been practicing for a dozen or more years in the same area, and you're like, well, I'm master at this craft right now, I'm really like catching my stride, and it doesn't fill me up anymore, I have this interest in a different area of practice, do it anyway. Grab these opportunities to find what you love out of this field, because it is too broad and too dynamic to just let traditional practice be everything that we are. Find the people that feel the same as you. Your people are out there. Find them. They're there. Mm-hmm. You may have to do an interview. When I did my interview with Kaitlyn and Amy said, well, we're pretty chill here. Can you be pretty chill? And I said, I can be the chillest little ice cube that you've ever seen. And here we are.
Yes.
But your people are out there. You're not alone in your thinking. And there's so much to occupational therapy than just what we learn in school. And there are mentors out there ready to show you all they've learned throughout their career and, throughout their lives.
Yeah. I kind of thought I was on a little island myself, and people thought I was kind of wacko for leaving this job as an academic and go do this. And I thought I was a little not an iceberg, an island. And then Kaitlyn shows up. And then Maddie shows up. Never thought that would happen, so I'm super curious to see who shows up next.
I remember Amy and I talking one day, I think just during lunch one day at our other space, and we were just talking about how we I mean, obviously Amy and I kind of vibe off of each other, and we geek out over very similar things, but we talked about how, like, we'll talk to other people about this and they get it and they think it's cool, but it does not fuel their fire the same way that it does with us, and how it's really hard to kind of find those people. And we didn't know if Maddie was going to be one of those people or not, right? We knew that she was going to be interested in it and she wanted to learn more about it, but we didn't know if it was going to truly fuel that same fire. And it's, I think, exactly what Maddie said. Those people are out there. We just don't know if we're in the same community yet, and that's what we're trying to build, both on the Mayer fascia wellness side of things and on the fascia-informed therapist side of things, is community of people that are just wanting to learn from each other and seeing how we can better serve others. And I think that's the piece that goes far and wide.
Yeah. Yeah, it'll happen. I think when other people start learning how foundational the fascial system is and the science behind it, there's going to be so much innovation in the world of OT and a lot of other health professions too. Agree?
Cheers.
Yes. Yeah.
Okay, Maddie, thank you. I'm so glad that we found time to do this in your busy graduation time. Thank you so much.
Yeah, thank you for having me, and thank you for the amazing experience I got to have. It is something I'm going to take with me for the rest of my career, genuinely.
Yes.
Thank you.
Yes. Thank you for tuning in to the Fascia-Informed Therapist. It's been a pleasure sharing insights and strategies to help you integrate fascia science into your practice. I'm Amy Mayer, and I hope today's episode has inspired you to explore further and take your therapeutic skills to the next level. Remember, we're committed to creating and providing top-notch, evidence-based, fascia-informed continuing education that empowers you as an occupational therapy practitioner. Stay connected with us for more enriching content, and don't forget to check out our online courses to deepen your expertise. Until next time, keep expanding your knowledge, refining your skills, and confidently applying the science of fascia to your practice. Here's to advancing together in health and wellness.